Some of today's papers describe the escalating dispute as war.
So this is not a war at all. We're desperate to go back into negotiations and discuss a better and fairer contract, and that's what we're fighting for.
I just feel very strongly about the imposition of the contract.
I personally do not care if I get a pay cut. I can absolutely say that. I know I'm going to have a middle-class salary for the rest of my life. I'm very grateful for that, but this is about more than pay.
It's clear this dispute has become increasingly bitter. Today outside the Queen's Medical Centre, I think it's fair to say there are more striking doctors out here than on any other of the strike days. And the mood of these people, well, it's very defiant. You missed out on about £1,000 through striking.
Yeah.
How do you feel about that?
I think on balance it's a small price to pay. From the calculations we've done in the course of our career, if the new contract gets imposed, I will stand to lose a lot more than that.
We thought that maybe Jeremy Hunt and the government would listen to what we had to say and how unsafe we all feel this new contract is, but we feel we really have no option now.
Patients told me with consultants and advanced nurse practitioners doing most of the emergency cover, things seem to be going smoothly enough.
Junior doctors at Leicester's emergency department, as well as the 3 hospitals, have walked out this morning in joint action against the government. You'll remember that there's been a series of demonstrations in recent months in a dispute over this new contract, which junior doctors claim is the wrong way to go about providing a 7-day service. They say they're already doing that, but the government are imposing this new junior doctors contract, which has led to the first time ever emergency cover is being removed as part of today's strike. Well, BBC Radio Leicester's Helen McCarthy is on one of the picket lines for us this morning. Helen, where are you today?
Morning, Jim. Yes, I'm outside the Leicester Royal Infirmary here on Welford Road. Behind us is Leicestershire's only emergency department, which for the first time in history is being affected by strike action. Now, how affected it will be is the question over the next 2 days. Now, government laws mean only 6 doctors can be on any picket line at any time, but as you can hear, they've been joined by supporters, by visitors, and I will say there are more visitors, there are more people here today than I have ever seen at any of the junior doctors' strikes. So there's about 35 people here this morning, and people, of course, are tooting as they go past. Now, let's have a word with some of them. We've got Amit Paik from the British Medical Association, representative here. Amit, this is getting serious now. There's no cover in accident and emergency from junior doctors. Is this putting people's lives at risk?
Today's a really unprecedented day in the NHS, to be honest. It's the first time we've obviously gone for this full walkout. And it's all been down to Jeremy Hunt and his absolute relentless threat of imposing this unfair, unsafe contract on the junior doctor workforce. In terms of the concerns about patient safety, look, there's a huge amount of preparation already gone in with hospitals across the country, including the ones in Leicester. We made it quite clear that the consultants are taking the charge now with leading services, and they've reassured us that services will be maintained, safety will be maintained. There's consultants on every ward today.
There's consultants out there, but there's also people who are less qualified than doctors who are working in the emergency department.
You've got a variety of nurse specialists. I think they've got a wealth of experience themselves, and like I said, they're all being led by the consultant body today, who are determined to run the show and run a safe NHS today.
OK, 55 operations have been cancelled across Leicestershire for the next 2 days. More than 1,200 appointments rearranged too. You know, you can apologise for this, but it's costing the NHS money.
Just to, again, apologise, really. I mean, I feel really bad. I'd rather very much so be on the wards at the moment caring for our patients. That's what I went to med school for. It was not my intention at all to strike. However, we've made it quite clear that the threats of imposition are becoming very real, and despite huge number of people, including government advisors, leaders within the medical and surgical field saying this is not right, Jeremy Hunt still wants to impose.
Let's have a word with some of the other doctors here. We've got Thomas O'Neill, who's a junior doctor in the radiology department. You've come out today. Is this really just about pay? I mean, we've got signs saying that it's not up here, placards, but really we've heard this morning that Saturday pay is the only obstacle left.
So I think this is misleading from the government. there's many more issues than pay yet to be sorted out. Pay is part of it, but equally I think there's insufficient safeguards on the contract, on the hours worked. I think there's some issues with how women are being treated. Their government's own equality and impact assessment said that this will disproportionately affect women and those caring for children, and in the 21st century that really does not seem reasonable for a finished contract to be saying that it will affect them disproportionately.
You mean because women have got to work 7 days a week, Saturdays and Sundays?
Well, we already work 7 days a week, Saturdays and Sundays. What I mean is the government says this new contract may affect women and those caring for children more than men, and such a regressive step in the 21st century just doesn't make sense.
Does it make sense, though, to stop emergency care? For the first time in history, junior doctors not providing emergency care for 2 days.
So, I mean, it's difficult, but I really don't think the government has ever really listened to the BMA, the people who are representing us junior doctors during the strike. So I think when you're left with no other option, this is where we've had to go. The government have never said we will delay the imposition. They've never said we'll talk properly. So backed into a corner. What else are we supposed to do?
Okay, just the last word with Abigail Annis, who's a junior doctor here working in obs and gynecology. Came up to me this morning, really wanted to make one point. What is that, Abigail?
Well, I just really want to emphasise that patients will be safe if they come to hospital today. This is a full walkout of junior doctors, but all the consultants are working really, really hard today to cover all the posts and to make sure that anybody who comes is taken care of to the best of their abilities.
Even if you've got people who are not as well qualified as doctors working in there?
The nurse practitioners have stepped up. In many cases, they are equally as well qualified, I think, as junior doctors, and the consultants are there in large numbers, more numbers than they would normally be, to make sure that everybody is kept safe today. So nobody should stay away from hospital. If you need to seek medical help, you will be safe today.
Thank you very much for speaking to me this morning, guys. There's a lot of people out here on the picket line this morning, Jim. As I say, there have been figures saying that less doctors will take part in this strike. I mean, from what I can see, there are more out here than there have been on previous days.
Helen, thank you. Helen McCarthy reporting there from the Leicester Royal Infirmary on the picket line this morning. Hospital bosses urging you, of course,